Viral hepatitis is one of the biggest global health threats on our planet. Each year, the disease claims the lives of nearly 1.5 million people. Right now, there are at least 300 million people living with undiagnosed viral hepatitis. If left untreated, the disease may lead to advanced liver scarring and other complications, including liver cancer or liver failure. July 28th marks World Hepatitis Day and provides an opportunity to raise awareness for the different forms of hepatitis and how they are transmitted, strengthen prevention by screening for viral hepatitis and its related diseases, and increase hepatitis B vaccine coverage and integrate the vaccine into immunization programs. The World Health Organization has presented a global strategy aimed at eliminating viral hepatitis as a public health threat by the year 2030. Awareness is the first step. The specialists at Advanced Gastroenterology and Surgery Associates explain what hepatitis is and how it is treated.
Hepatitis basically means inflammation of the liver, and there are many things that can cause hepatitis. But however, most people concentrate on the hepatitis viruses. Of the viruses, there are approximately 5 hepatitis viruses, A, B, C, D, and E. The one that's causing the most difficulty right now is hepatitis C. Chronic hepatitis C sort of come to the forefront of medicine over the past several years. We know that the most common reason for liver transplantation in this country is for hepatitis C. The CDC has released recommendations of the baby boomers, people born between 1945 to 1965, to routinely have their blood tested for hepatitis C, regardless of any other risk factors, even with normal liver function tests. And the reason this has come to light is that what we've observed over the past few decades is that people born between 1945 to 1965 have 5 times the incidence of hepatitis C than people born in other decades. Also, the testing probably didn't get out of blood banks at least until 1992, so that anyone who had a blood transfusion prior to 1992 would have been at high risk to attain the virus. The vast majority of patients with hepatitis C are what we call asymptomatic. They have no idea that they have the virus. You know, they may have very mild fatigue, sort of mild myalgias, almost like the common flu. However, the vast majority have no symptoms at all. And that is why we ultimately diagnose them when they already have advanced liver disease with cirrhosis. Patients will come in with complications of cirrhosis and found to have hepatitis C, and they never knew that they had it, and they were probably exposed to the virus 20, 30 years ago. So the focus is on the primary care physicians to start testing their patients for hepatitis C, regardless of other risk factors that we normally follow. Initially, we'll get referrals from the primary care. And then once we start treatment, the injection therapy is once weekly and the pills are every day. And we initially see patients at least once a week, attaining labs, monitoring their complete blood counts and other factors. And as time goes on, if they're doing fairly well, we sort of extend the labs to maybe every 2 weeks, every 4 weeks. The treatment can last for as long as 48 weeks, but it can be as short as 24 weeks. Right now, hepatitis C is a significant healthcare burden. It's probably estimated about $3.3 billion a year, so we're trying to improve that. Now that we have a better handle on the treatment, we think that the incidence would start to decrease, certainly by 2020.
You'll find more information on Advanced Gastroenterology and Surgery Associates when you click the Hepatitis Awareness Month link on our homepage, yourhometownhealth.com.